Hi there, my name's Dr. Ross Dyer-Smith. I'm the clinical lead for DXS for Lambeth CCG. I'm also a practicing GP in Lambeth at Riverside Medical Centre in Vauxhall. This video is basically a short introduction to DXS to show people how it works and how it interacts with the GP clinical system. It's useful for GPs and practice staff, and also any CCG members who want to look to see how things work within the clinical system. It's also very useful for secondary care, tertiary care and third sector providers, so you can get an understanding of what may happen if you actually provide content to Lambeth CCG that you'd like GPs to be able to access. So for those of you who are not familiar, you're looking at EMIS Web, which is the commonest clinical system in Lambeth. In fact, everybody uses it. You'll see that we've got a patient selected here, a dummy patient, of course, and at the top there, you'll also see the DXS, a little floating bar up there. So this is a separate piece of software that actually interacts with EMIS Web. What DXS actually is a very large repository of clinical information. But it can be designed to reflect local services, local referral pathways, referral forms, etc. And I'll give you a quick walkthrough and just show you some of the features so that you've got a very simple and useful way of actually understanding how it works. So if I just add a consultation here, as GPs, we basically use a lot of read codes, so I'm going to put one in here. Read codes are associated with names as well, or description of the actual condition. So here I'm going to use breast lump 1A8, and just say OK. Now for the eagle-eyed of you, you would have noticed at the top right there, a little drop down occurred in the DXS box. It's also flagged up the code. What that's basically saying is it's recognised the code I've put in, and it's also recognised that within DXS it's found some content that is linked to breast lump symptom, and said, click here if you want a bit more information. I can just carry on if I, can ignore that if I wish, but I'm going to go and show you what it actually does. So this is now opened up DXS. This is DXS you're looking at. And you've got this landing page now. It's flagged up breast lump symptoms. It's flagged up some 2-week wait referral forms. So I can open that up. It's populated with the patient's name and details, and any blue stuff I can edit. I can then save the form within the record, and basically it's saved that within EMIS Web. So when I go back to EMIS Web, you'll see it's saying that it's been updated, and within documents you'll see there the referral form. It's also in what we call care history as well, so it's here. It's also pulled through a read code, which is fast track referral for suspected cancer. It just means it's now tagged in the notes, so if we ever need to find it. And that's basically how it works. Now, I imagine there's probably a few GPs out there who say, well, I don't actually put read codes in whilst I'm consulting, I'll do it after they've left. And that's fair enough. So the other way you can use it is there's a little search bar there, and you can type in cancer, press return. This will search through the whole lot. And you'll see everything here tagged Lambeth CCG, all the 2-week waits. There's lots of other stuff here, like patient.uk stuff, and even stuff about medicines and things like that. But this is the stuff that's really important. So that's another way you can use the system. In addition to that, of course, you may just want to open the whole thing up, which you just click on the home button. And then use the search bar here, or go into the subsections here. Now the subsections in the professional tab, which is where the Lambeth CCG content is. You'll see there's lots of subfolders here. There's the cancer one in there, and there's lots of stuff within that, and also all the referrals. And again, there's a bit of content missing off here at the moment because we're uploading stuff as we speak, and that will get longer and richer the more content that's sent in to us. But I hope that's been a useful introduction. There'll be some other videos with a lot more detail of some of the sub-functions specifically designed for actual GPs who are going to use the system.